keep hearing of therapy, interventions, the role of parents, independence, and it goes on and on and on. How do they all come together? That's our topic on the Ability Conversation Room today. We'll be taking one of the therapy sessions and we'll be breaking it down as simple as possible for the parents and everyone who is interested. Of course, you know my name is Medwa Onyema, and I have with me my delectable wife, Wande Onyema. Welcome to the show, darling.
Thank you.
Yeah.
Welcome.
So let's not waste any time. Let's jump right into the question. What is occupational therapy? And I know it is one of the many therapies. Just give us an insight into what therapy and occupational therapy majorly is.
Okay. Occupational therapy is one of the therapies that addresses developing skills in children that help them with their daily living. So it's like you're building or developing the ability to function properly in their daily living. So these skills will be fine motor skills, which has to do with writing, feeding, grasping things. Then you have another part of motor skill, which is gross motor skill, which has to do with the coordination. So body coordination and walking, jumping. Those are the things that gross motor skills have to do with, right? And then some other skills that you can build in occupational therapy would be helping them with their sensory issue. Some children have issues with auditory sensory issues, like they put their fingers in their ears, you know that they are not comfortable with a particular sound or the way sound is coming to them. So the way the sound comes to you naturally and you're like, this volume is okay. To a child with an auditory sensory issue, the child will keep putting their fingers into their ears to block out sound. So I think we'll go more into it. So that's just
you already started answering the second question.
Yes.
Which is what signs do you notice in children before you know that they need this particular intervention? Okay.
For children, for you to know that a particular child needs occupational therapy, you will notice, for the fine motor skills issue now, you will notice that child cannot grasp things. They can't hold onto even their toys. When you put the toys into the hand of that particular child lets it go. The child can't grasp it. You know that child has issues with fine motor, and that child needs occupational therapy. So for children who are clumsy when they are walking, either they bump into things, just know that child needs occupational therapy too, in gross motor skills. Then for children who tiptoe, you just know that this child is either that child has sensory issue or the child needs occupational therapy in gross motor skills. So there are certain things that will be done for that child. Yes, in occupational therapy for that child to correct the tiptoeing, so the child can walk on barefoot properly. Then for the sensory issue, there are some children that they are sensitive to sound. So they're hypersensitive to sound. Just know that child needs occupational therapy in the area of sound to be able to regulate and also tolerate a certain kind of sound. So you realize that child is always putting fingers into their ear to block out sound. The sound that you think there's nothing noisy here, but that child keeps putting their fingers into the ears to block out sound. So you know that child needs occupational therapy. Yes.
So you see that sometimes when you mention this interventions to parents, I can just imagine them thinking, so how would this apply to their daily living? How would it help them to be independent?
Okay. So how occupational therapy helps the child to be independent will be in different ways. So, we have lots of ways. We're just picking out a few of these numerous skills that these children need to build.
To build.
So for a child to be independent in fine motor skills would be that the child can now write without the support of the therapist or the parent. They can hold their pencil by themselves. You may not need to even put your hand over their hand to make sure they are holding the pencil. So one way or the other, the therapist, the occupational therapist, has been able to help that child develop skills in fine motor skills, in writing, that child doesn't need a therapist or their parent or someone to hold their hand while writing. They can write by themselves. So that's for fine motor skills.
Yes.
There are a lot of other examples under fine motor skills, but that's writing now. You can see that child will be independent.
Yeah.
And going forward, when the child becomes an adult, the child doesn't even need support to in writing. Eventually, I think we were discussing earlier that the child, when it becomes an adult, can sign documents. When, you know,
so that's a very useful skill.
That's a very useful skill. Writing, as much as we have computers and tabs now, but the child still needs to develop the skill of writing under fine motor skills. And then another thing that will make a child independent, dressing up. As little as zipping up and down. If a child has not learned it through occupational therapy, the child will depend on the parent or will depend on the caregiver to help him or her dress up. Like we have here. We have a jacket here that has a zipper. You teach the child how to zip down and zip up. It looks simple to everyone, but for a child that has not developed fine motor skills in that area, would have issues zipping up and down. So if you make that child independent, child can dress by himself. Preparing to go to school or preparing to go anywhere with a parent, you don't need to be the one to dress that child, especially if it's zipper that has been, you know, the child has been taken through that process in therapy. And buttoning their shirts too. As a matter of fact, feeding. The child will be able to use their cutlery, either spoon or fork, to put the food in their mouth. That's still another independence they gain through occupational therapy. It goes on and on and on. Yes.
Okay. So can you just take us, now you mentioned the final result.
Yes.
Can you take us into a deep dive into what you actually do in the occupational therapy room?
Okay, so there are different sections in an occupational therapy room. So we have a particular section that, you know, this, depending on what you have observed and assessed this child on. If you feel you have assessed this child and you realize this child needs to work on their fine motor skills, there are different materials that will be used for that child. You can find something like this. This is called a sensory ball, also stress ball. So this addresses a lot of issues. It could address the fine motor skills to strengthen the finger muscles of this child, so that the child will be able to grasp and hold something tight. So eventually, when the child is ready to start writing, you've already developed the strength of the muscles. So he's not holding pencil and the pencil is falling off. Or he gets to a stage where he's holding pen. He's not holding pen, the pen is falling off. The child already has a strong grip. Do you get what I mean by that? I mean, like I called it, stress ball. The child is having meltdown. This stress ball can even help to calm the child down and regulate the child emotionally. So because it has spikes, it has some rough textures that will help, that has a sensory stimulation for that child. So this is just one of the other examples. For the other fine motor skills issue we're trying to sort out, we can use building blocks. So a therapist is introducing a child to using building blocks, can stack the building block in front of the child and also take the hand of the child, put a hand or his hand over that child's hand and help the child to start stacking the building blocks. It will strengthen the finger muscles too and help the child in other areas of using fine motor skills. So that's just one part of it. So we have the auditory auditory issues too. When the child has issues, sensory issues in sound, in the area of sound, you introduce the child to the noise cancelling headset, especially the ones that have hypersensitivity to sound. You bring it in, you allow them to filter out the strong sounds that are strong for them, because to you the sound may be okay, but to that child who has hypersensitivity to sound, you will need the noise cancelling headset.
Oh, nice. Oh, nice.
And for those that have, for the section that addresses poor body coordination or poor coordination, you help the child to walk on a straight line, either on a beam, if it's in an occupational therapy room that has been structured to be like that. They will have beams that you help the child to walk on a straight line. Then sometimes you can even improvise and put the sensory mat, allow the child to walk on it, or allow the child that needs to correct their tiptoeing to walk on the sensory mat. The sensory mat. So this sensory mat most of the times they come in tiles. Just the way we have floor tiles. So they attach the tiles to one another, and you can arrange it in any way you want. You can arrange it straight, and the sensory mat usually have spikes like this. They are not too harmful, but they prick the child's feet. So instead of the child putting the tip of the toes on the spike, the child is forced to release the other part of the foot. So the child is able to walk, and it corrects the tiptoeing step by step. That sensory mat for that child, some people call it barefoot stimulation. So you allow that child is not wearing a shoe when the child is on the mat, sensory mat. The child will be barefooted,
more or less to stimulate
the nerves under the feet, so that the child is able to like place the feet flat on that mat instead of walking on tiptoes.
Nice.
So that's just one of the numerous
interventions that you come
in the
up
sensory room. In the occupational
room.
Therapy room. Yes.
Nice. I know that we especially even on this program, we emphasize the role of parents, the therapist, the caregiver, and even sometimes the teacher in school. How do we maintain continuity of the intervention?
So
what's the role of parents?
So I would advise that the parents too should get these materials. Now that they understand through this video, I expect that they now understand the importance of occupational therapy. So I would advise them to get these materials and continue at home. And then as the therapist is doing his own bit or her own bit with that child, the parent is involved, seeing the way it works, so that, because the therapist does not spend 24 hours with that child. So the remaining hours of free time the parent has should bond with that child. It's a way of bonding. It's a family bonding. Yes, it's not just the one parent that should be involved. The two parents should be involved.
Even the siblings.
The siblings should be involved. So it comes in like play, comes in like games. So they involve, if a child is having issues with body coordination or poor coordination, the child can play with his siblings or with the parents, using maybe towel or whatever it is. You have rope at home that is soft for tug of war games. That corrects the poor coordination of that child, which is also gross motor skills. And then if the child has issues with texture, you realize that some children, their parents wear them certain clothes or socks, and they start itching or pulling them off. You should know that that child has sensory issue with textures. So they can introduce the child around the house, the different types of clothing you have. Allow that child feel it. Then you know the one that the child doesn't really, that the child reacts to somehow. The parents will do that too, because they are the ones who spend more time with the child, right?
Okay, that was a nice one. The role of parents in the lives of children can never be overemphasized. And that brings me to the last question. What are the myths around occupational therapy that parents majorly have about the whole process?
Okay, so the myth or misconceptions we
Yeah.
usually hear, or like the parents of special needs children have towards occupational therapy, one of it I would say is they feel we are playing. So a parent comes into the session just to check on the child and sees us stacking building blocks
together.
and then she says, you guys are just playing here. I don't think you're doing anything. You're just playing. You're just playing. But on the contrary, it's not just play. Well, there could be a form of play in it, but it does a lot. It solves a lot of issues in that child. It actually does therapy, because, for example, we have building blocks, and while stacking the blocks, you are teaching this child creative thinking. The child knows that I cannot stack the block like this. I have to stack it for them to go into one another, right? That's creative thinking. The child already knows how to do that. Then, apart from it, we're learning color sorting in the process of stacking building blocks. This child knows that this is color. We're already teaching the child colors, and then the child knows how to sort the colors. These are blue. Yes, these are blue blocks. The child puts the pink one separately, the yellow separately, and put other blocks together like that. So the child is already learning color sorting in the process.
Nice.
So the myth that or the misconception parents have is that they feel every occupational therapy session is just play. Meanwhile, children are getting therapy in it.
And I think one interesting part also is the fact that you are dealing with children who have very short attention span.
Exactly.
And it will just be good
and the best
to
way,
keep them occupied.
The best way
and
to
going with it.
Sorry to cut you. The best way to help them is for you to, in the process, play and do a form of games.
Exactly.
They have short attention span. So if you are approaching or like presenting occupational therapy to them in a form of work or something, a task, they get disconnected.
Nice.
They get uninterested in it.
Nice.
So
nice. We can go on and on. I know it's not scratch the surface
at all.
We can go on and on and on. But I hope parents have gained a lot of information, understanding what actually goes on in that occupational therapy room. It's not just play. It's not just waste of time. But your children are actually gaining major interventions. So thank you for being part of today's episode. We look forward to having you in subsequent ones. And for the ones that are already up, please engage, like, share, subscribe so that you
comment.
You are up to date with our information. Thank you for being there. Thank you for always having our back, and we look forward to many other interactions from you. Till next week, we say
bye.